Hello, my name is Dr. Mark Kwame Jiradosi. I am a clinical pharmacy specialist and I work for the International Maritime Hospital in Tema, Accra. Today we'll be discussing infection prevention and control and a guideline which has been developed for healthcare workers and medical facilities. And because we're in the coronavirus era, we will somewhat skew a little bit of the information towards coronavirus management within our facilities, while also thinking about other infections that may come up and how we can properly protect ourselves, our patients, and also manage them. So to start with, I have to state that this information was developed or adapted from the WHO guideline on IPC recommendations for the management of COVID-19 in healthcare facilities. And also, information was also gathered from WHO scientific briefs and other publications on IPC. The outline or contents that I will be speaking about include general principles of IPC strategies associated with healthcare for infectious diseases in general, general principles of IPC associated with COVID-19 or confirmed cases of COVID-19 management, guidance and practical advice for management of visitors, especially to our facilities, and then even those also from COVID-19 community transmission areas, and then guidance on IPC considerations for surgical procedures in patients who are confirmed, who are infected, not only with COVID, but or with other infections, and then considerations for dead body management in our healthcare facilities, as well as a few other things. So to start with, this document has been developed as a guide, so it's not cut in stone, which means your facility can have other added policies or strategies in helping control infection and also preventing infection within your facilities. So it's just a guidance document, and we'll spell out a few strategies that can be used in the management of COVID to prevent healthcare workers and their families, as well as also manage other infections within your facilities. It's intended for health workers, including healthcare management or managers, and then IPC teams within your facilities, the national level, district level, and the sub-district levels. So this document basically is for everyone within the healthcare sector. So we start with the principles of IPC strategies associated with healthcare for suspected or confirmed cases of COVID-19. And ideally for optimal response to COVID-19 outbreak, using the strategies and practices recommended in this document, we recommend the following, and these are recommendations from WHO, not an individual, and they have been based on real lifetime studies, data collected, analyzed, to make sure that when we implement these practices or strategies within our facilities, there will be some safety, and then there will be some good management procedures to protect healthcare workers and our patients. So for the first recommendation, the guideline recommends facility-level IPC programs with dedicated and trained teams of at least one IPC focal point person. So each facility ideally should have one person or more who are IPC focal people, and also this person should be supported by national or the facility senior management to help push out some of these good policies. Secondly, each facility should set up basic IPC standards at the national and healthcare facility level to provide minimum protection to patients, healthcare workers, and visitors. So basically, at least have the minimum standards in place. And the higher your standards, the better. But at least make sure that for everything, yourself, the healthcare workers, and your patients are well covered. Recommended IPC strategies to prevent or limit transmission of COVID-19 or other infections within the healthcare facility. So the first thing, especially for COVID-19, is to screen and triage for early recognition of patients who are suspected to have COVID-19, and then rapid implementation of source control measures. So when these people come in, we shouldn't relax on our initial screening and triaging. There are times people come in and it takes so long before we even identify them and then do the screening and before we send them to where they are supposed to go to. So each facility should have a very prompt screening and triaging system or policy that can help facilitate quick transfer of clients where they are supposed to be kept and then properly taken care of. And this includes other people who have communicable infections. All persons should be screened at the first point of contact with the healthcare facility, as well as inpatients with suspected COVID-19 to allow for early recognition, followed by their immediate isolation and separation. This is very key, and I think locally or nationally, all facilities now do the screening with either the temperature check and then also checking for symptoms and then other things, wearing masks and so forth. So what do we do? What are the recommendations for screening and triaging of clients or patients? So to facilitate screening and triaging, healthcare facilities should do the following. So display information at the entrance of the facility directing patients with signs and symptoms of COVID to report to a designated area for screening. So ideally, we do not want our COVID-19 patients or patients who are infected that can also infect other people with other infections to all sit in the same place or to expose themselves to other clients. So good information should be readily available either at the entrance or at designated areas to properly direct these clients. Also establish an entrance for patients with signs and symptoms of COVID-19. This can be a little difficult considering our setting because nowadays it's very difficult to identify by just looking at the person who and then deciding that they have COVID-19 or not. But for established COVID-19 patients who have the common symptoms and signs, ideally, if your facility is able to establish an entrance for them, a separate entrance, that is the ideal thing to do, and that is what is recommended. We should train all staff on signs and symptoms of COVID-19 and the most recent case definitions. COVID-19 cases continue to shift, the signs and symptoms continue to change and evolve, and constant or consistent training is very important, and facilities or nationally we should have put a plan in place to continually update the knowledge of our staff members, our patients, and all who care for COVID-19 clients. We should encourage health workers to be alert to potential COVID-19 infection in all patients. And this is very key. We should have a very high sense of suspicion. Basically, assume everybody that comes into your facility is a potential COVID-19 patient until proven otherwise. That is one way to protect yourself. That's one way to protect other patients or clients. And that is one way to also manage your cases well. Establish a well-equipped screening and triaging station where screening questionnaires are used according to the most recent WHO and Ghana case definitions. This is very important. So ideally for infection prevention control, it is not good or it is not recommended that you screen or manage all type of clients in the same location. So have a dedicated area for managing your COVID patients or other infectious patients. Ensure that screening personnel maintain a distance of at least 1 meter from patients. 1 meter is equivalent also to about 3 feet. So depending on what part of the world you are, this is very key. Now we go to places and people are still sitting bumper to bumper. With COVID-19 or other infectious diseases where infections can be spread from one person to the other, at least 1 meter should be between the patients. We call something social distance. I call it physical distance. So you should spread them out properly and keep infections away. So at least 1 meter and then ideally separated by a glass screen or plastic screen. This in a medical setting can be a little difficult to achieve, but where you can actually create a glass screen, the patient sits behind the glass screen and you are able to actually do your screening, and that protects you, the medical person or the healthcare professional, and also the patient as well. Use the screening algorithm to promptly identify and direct patients with suspected COVID-19 to an isolation room or dedicated COVID-19 waiting area. And then also suspected COVID-19 patients or infected patients should wear masks, especially if through droplets or anything they can easily infect another person. So all those patients suspected to have COVID-19 must wear masks if it's possible for source control purposes, and to be positioned at least 1 meter apart from each other in a designated well-ventilated area. One of the key things we'll be stressing on in this guideline is ventilation, and so for our clinics, our hospitals, our locations, we should ensure that there's adequate ventilation. Ensure that a process is in place to reduce the amount of time suspected COVID-19 patients wait to be screened. This is also key. Sometimes it's difficult because our hospitals will come with or will have so many patients in line to see a clinician. But as soon as we identify somebody who is a potential COVID-19 client or is showing symptoms, we should not let them join the general pool. Ideally, we should have a separate line or a separate area for them to be assessed, screened, and then triaged properly. After screening and isolation, triage patients using standardized or validated tools to identify those in need of immediate care. Some of the patients that may come to you, and this is not only on COVID-19, anything from even the non-communicable diseases, asthma patients, infected patients, but even for COVID-19, there are some that will come with respiratory symptoms, and they cannot breathe, or they are weak, and all that. Those should be taken care of preferentially so that they can be sent to the appropriate area for care so that we do not lose them. Suspected COVID-19 patients with symptoms of respiratory diseases and severe underlying conditions should be prioritized for medical evaluation. Isolation or designated waiting area. It's very important that hospitals or healthcare facilities have isolation or designated waiting areas for our COVID-19 patients or patients who have other infections that may lead to being passed on to others. So there are some places that may have single isolation rooms in the emergency departments. If you do not have those, then the hospital should have a well-ventilated or designate a separate well-ventilated area where patients who are suspected to be infected can wait before they are seen. This area should have the necessary things that patients will need, like a bench, a stool, chairs, which are also placed with social distancing or physical distancing 1 meter apart minimum. And then this area should also have places for dedicated toilets, hand hygiene station, a waste bin, and a lid for disposal of paper and tissues used for respiratory hygiene and other hand washing. So ideally, this place should have everything that the patients need, so they don't have to come out and go to other places for places of convenience, and also display graphic information for patients to show them how to perform hand hygiene and respiratory hygiene. I think this is something that most facilities do have now, so it's a good thing. Our healthcare facilities should promptly detect inpatients with suspected COVID-19 who were missed by screening and triage efforts or have become infected within the facility. This is very key. There are people who will come and do not show any symptoms, especially if they are in the initial stages of the infection and they are not showing any symptoms, and later on then they start showing symptoms. So it's very important that as they come and they are become inpatients, they are admitted. As healthcare persons, we keep a very close eye on them, and once we see any new developments in their health status, we move them and have them rechecked for COVID-19 symptoms or other infections and triage them appropriately. Healthcare facilities should also, in addition to what I said above, encourage healthcare workers to look out for potential COVID-19 cases, not only the inpatient ones, but people who walk into the building or within the facility. Encourage rapid testing and reporting of patients with COVID-19 who have been identified for hospitalization. Data collection nationally is important, so whenever you identify any patients, the key thing is to rapidly start treating them and then also report to the proper authorities for appropriate data management. And then establish reminder system to clinicians to consider COVID-19 based on signs and symptoms, especially in areas with community transmission. So basically, as clinicians, we should always be watching for any patient that comes. We should screen and screen appropriately, and keep reminding ourselves that anybody can come in and they could be potentially infectious. How do we apply standards of care for all patients? The key is for applying these standard precautions is to ensure that we reduce the risk of transmission of bloodborne and other pathogens from both recognized and unrecognized patients or sources. So standard precautions include, but not limited to, the following. So hand and respiratory hygiene, which we all know about as healthcare professionals, use of appropriate personal protective equipment according to risk assessment. So it is not a one-size-fits-all, which means when you are going to certain high-risk areas, you must be properly protected. Environmental cleaning and safe waste management. Waste management in IPC is very, very important, and each facility should take this very seriously to minimize the risk of transmission of infections. So hand hygiene, what are we supposed to do? For optimal hand hygiene and performance, health workers should apply the following principles. One, we should perform hand hygiene before touching a patient, which I'm sure we all know, before any clean or aseptic procedure is performed. And then after exposure to body fluids, after touching a patient, and after touching a patient's surroundings, which means once you get into a patient care area and you touch anything, before you touch, sanitize or wash your hands. Once you're done, you wash out again. So we have a term that we use at my hospital called wash in and wash out. So before you go in, you wash. When you come out, you wash, and that keeps everybody clean. Hand hygiene includes either cleansing with your hands with an alcohol-based hand sanitizer or hand rub containing at least 70% alcohol, or with soap and water under running water. So make sure that especially if it's soap and water, you're washing for minimum of 20 seconds, and then use disposable towels, not the regular towels that everybody will come and use. Alcohol-based hand rub products are preferred if the hands are not visibly soiled. So there are times that we wonder, okay, I just went to see a patient, touch them and everything. Should I still go and wash my hands? My hands are not soiled. Yes, in such cases, you can still use alcohol-based, but once you suspect that you have picked up anything on your hands, ideally you should go and wash your hands with soap and water. That is proven to be safe and probably the best. Use the appropriate technique and duration for performing hand washing. I mentioned the 20-second rule, longer if it's better. If you're using alcohol on a surface that is contaminated, ideally you should do that for a minimum of 1 minute before you can wash up with water or clean it out very well. Respiratory hygiene, ensure that the following respiratory hygiene measures are used. One is to display graphic information on the need to cover your nose and mouth with a tissue or a bent elbow, which I'm sure by now every healthcare worker within the country should know. And then perform hand hygiene after contact with respiratory secretions or objects that may potentially be contaminated with respiratory secretions. And give patients with suspected COVID-19 a medical mask to wear. That is key. And to be honest with you, not every patient is able to wear the mask because they can't breathe well. But in cases where the patient is coherent, can wear a mask, let them wear a mask. If they cannot wear a mask, make sure you have double or triple protected yourself, either with an N95 or FFP2, KN95, There are times that if those things are not available, I've seen some medical staff now wear double masks just to make sure they are properly protected. What about the use of PPEs? The rationale for and correct use of PPE reduces exposure to pathogens and protects us. And I mean us because it can be me, you, as a healthcare professional, and also the patient, their caregivers, and their families. And don't forget also, healthcare professionals can also develop COVID or can also develop other infections which can be transmitted to others. So the effectiveness of a PPE strongly depends on one, staff training on putting on and removing of the PPE. So how to don and how to take it off. That is one major thing. There are many of us who may not even know how to wear an N95 or a regular mask or face mask. So the training you have, the appropriateness of you doing this goes a long way to protect everyone, to protect you and your patient. Prompt access to sufficient supplies. This is very key. So personal protective equipment should be readily available at all facilities. Appropriate hand hygiene, health worker compliance. There are times we get so tired of wearing the mask and we want to take it off, but compliance is one of the key ways to stay protected. Regular monitoring and feedback by the IPC personnel or the team. That's also very key, so we should be each other's keeper. Environmental cleaning, what should we be doing? Cleaning and disinfection procedures should be followed consistently and correctly. That's one very key statement. The two words here are consistently and corrected. So sometimes we tend to just outsource cleaning to the lowest level people, but this is a case that when it comes to IPC, the people who do your cleaning must be very well educated on even the proper types of detergents to use, the proper types of tools to use, how well they can protect themselves, how they can protect the environment and the facility and the staff and everything. So all surfaces in healthcare facilities should be routinely cleaned and disinfected, especially high-touch surfaces, whenever visibly soiled or contaminated by body fluids. This is very straightforward. We shouldn't leave contaminated areas unclean for some time and say, oh, let me go take care of this and come back. Very important that once a place becomes soiled, especially with any material that can be infectious, it should be cleaned right away. Then aside from that, also set up a cleaning schedule with somebody who has oversight over this. In summary, we should be doing the following. We should clean environmental non-porous surfaces effectively by one, using water and a detergent, and applying disinfectant solution. And if it's for COVID, either 0.1% sodium hypochlorite or 70 to 90% alcohol are effective. For large spills, you can use 0.5%, which is 5,000 parts per million sodium hypochlorite. And then the contact time for the disinfection should be about 1 minute. So you spray these things or you apply and wait for a minute, and then you can wash it off with soap and water. Appropriate contact time, disinfectant residue may be rinsed off with clean water if required, or you can also wipe it off with a very clean cloth. Medical devices and equipment, laundry, food service, utensils, medical waste should be managed in accordance with safe routine procedures. And I have to state that even your medical devices, your laundry, your testing equipment, everything should always be sanitized or should be cleaned to ensure that there is no spread of infections. And there are guidelines for appropriate management or cleaning of these areas. And I suggest that if there's an institutional guideline, you make yourself familiar with it. For waste management, healthcare waste products produced during the care of patients who are infectious, especially COVID-19 patients, is considered to be highly infectious and should be collected safely in clearly marked lined containers and sharp safe boxes. This is very important. So healthcare waste, we sometimes think, oh, okay, I just took a plaster off somebody, just a cotton swab or whatever, or I can just throw it anyway. When it comes to infections, this becomes very important because anything that is considered waste can be infectious, and we have to protect ourselves, protect everybody around us and our clients. To safely manage healthcare waste, our facilities should do the following. So one is to assign somebody to be responsible for the waste. We shouldn't just say, oh, we have the orderlies and we have the cleaners, so they will take care of it. We should have somebody with oversight responsibility. And number two, have adequate human and material resources to segregate and dispose of the waste. So ideally, we should treat waste on site if we can. I have to admit that not every facility has a waste treatment plant or equipment, and sometimes they will have to send things out. But even if that has to be done, if waste is moved off-site, it is critical to understand where and how it will be treated and disposed, and even how it is being moved. So we shouldn't just put it in a rubber bag and say, okay, yeah, Mr. Kojo, take it and go. He may get tired and throw it somewhere, and then it ends up now infecting a lot more people than usual. Use appropriate PPEs. So the people who manage waste within your facility must be adequately resourced. So they need their boots, long sleeve gowns, heavy duty gloves, masks, goggles, face mask or face shield, depending on the type of waste that they are managing. If it is nothing that has to do with spillage or anything, at least the face mask, the gloves, heavy duty, long sleeve gown, boots, anything to protect them, because they are also members of the medical team, and as equally as the doctor's job is important, so is the job of the orderly or the person who is cleaning. Prepare for an increase in volume of infectious waste during COVID-19 outbreak, especially through the use of PPEs. And sometimes we forget that the PPEs that we wear and throw away, or we take off, from the masks to the gowns to the socks, everything is infectious or can be infectious. And this is where we also just have to take note of the fact that our PPEs they are potentially waste products and should be disposed of properly. How about when the unfortunate thing happens and we lose the patient? How should they be managed? So health workers should do a preliminary evaluation and risk assessment before undertaking any activity related to the management of a suspected or confirmed COVID-19 fatality, or basically anybody that has developed an infection and passes away within your facility. You should do a proper risk assessment. Can I touch? If I have to touch, what do I need to have on to touch this person? A WHO has an IPC guidance for safe management of dead bodies, and I'll recommend that your department looks into this for the expanded version to see really what is done. Also, Ghana Public Health document does cover this extensively. So for dead body management, this is a summary. We should always perform hand hygiene before and after handling the body. Use the appropriate PPE based on the level of interaction with the body, and increased assessment and risk assessment. So for example, we should use eye protection and medical masks in addition to gloves and fluid-resistant gown or apron if there is a risk that the patient or the dead body you're going to handle has fluids that can splash on you while handling the body. Ensure that any body fluids leaking from crevices are contained and cover body, and we should also cover the body with cloth to transfer to the mortuary area. Do not engage in any other activity during handling of the body or preparation, or disinfect any non-disposable equipment used during handling of the body as per the WHO or national guideline on cleaning and disinfection in the context of COVID-19. So any dead body we handle, during the process of handling this body, we should not break to go and do anything, because you may end up infecting other areas. Correctly remove and dispose of PPE when finished. There's a video on this which you can go and watch. So health workers should perform hand hygiene before and after handling any dead body. We should use appropriate PPEs based on the level of interaction that we will have with the body, and also the risk assessment So if it's a high-risk patient, or if this patient we're going to handle may have fluids that may splash or anything, we must use eye protection and medical mask in addition to the gloves and fluid-resistant gowns that we will wear. Ensure that any body fluid leaking from crevices or any part of the body or orifices, which is the entryways, are contained, and cover the body in cloth on our way or on transfer to the mortuary area. And then during this process, we should not engage in any other activity during body handling or preparation. We should correctly remove and dispose of PPE when we are done. And this is important because sometimes we forget ourselves, and in the process of removing PPEs, we end up infecting ourselves because body fluids may have splashed on it, or other infectious material may have gotten onto the PPE, and if you don't remove it well, you end up infecting yourself. Body bags per WHO are not needed for COVID, but if it is other infections that may end up infecting the person handling the body, they are necessary. But WHO also does recommend that, especially for our part of the world where temperatures are warm, we should ensure that each patient that has passed away, when they are being transferred, they are in a body bag, and if cremation is not supposed to be done, or burial is not going to be done within the next 24 to 48 hours, then even a second body bag should be used. So I believe the Ghana guideline does specify that we should use body bags for our COVID patients, and then in some cases, use a second body bag. What other additional precautions are needed within our facilities? One is isolation and cohorting of patients who are suspected with confirmed COVID-19. So when they come and you suspect them, we should make sure that they are isolated. We should cohort them well and know where to place them, depending on if their condition is mild, moderate, or severe, or even critical. We should have contact and droplet precautions, which every team member should be aware of, especially those who handle and manage the COVID-19 patients or other patients who can potentially infect the healthcare worker. And then there should also be airborne precautions, which each facility should put in place. Then, aside from all these infection control things, sometimes we forget that administration also has a role to play. So administratively, what should be done? So the following administrative measures can suffice. So one, administrative measures related to healthcare workers. So I've broken this down into the healthcare worker part, and then also our clients and their families. So this includes provision of adequate training. All healthcare workers should be trained on IPC, not just for COVID, but general infection control and prevention. We should ensure an adequate patient to staff ratio. This is key. If a staff member is overwhelmed because you've given them so many patients to look after, the quality of output becomes low, which means the patients may not get the best care, and their output or the quality of care they receive may not meet the standards. Establishing an active syndromic surveillance of healthcare workers at the facility entrance when they arrive at work. I noticed a lot of facilities now do the temperature screening and check to see if they are wearing a face mask. But we should go beyond that, which means when they come and they are coughing, when they come and they are showing signs and symptoms of COVID-19, temperature is up, they don't feel well, they are tired, dizzy, the typical symptoms, we should always make sure these things are screened before they get into the facility. When anybody is at work and then they become ill, ideally they should be sent home or sent for treatment, for assessment, to make sure that they are still safe to be able to work without contaminating or passing on infection to their co-workers. We should ensure that healthcare workers and public understand the importance of seeking medical care promptly. Sometimes we tend to try to be the heroes and not treat ourselves when we are not well, but this is very key. Whenever we are ill, we should seek prompt medical care and take very good care of ourselves. And we should monitor, as administrators, monitor healthcare workers' compliance with standard precautions and providing mechanisms for improvement if needed. Sometimes we make the rules, but we allow the staff to slip, and this can lead to untoward outcomes. What about how we manage visitors? So this is important to keep infections or to limit infections and to prevent them. So number one, we should conduct active screening of all caregiver visitors before entering the facility areas, especially in areas with widespread community transmission. There are times at some hospitals where a patient's family member will have to come and assist in the care of the client. But we should make sure that these people, all these caregivers, are properly screened before they come into the patient care area. And ideally, identify alternatives for direct interaction, if possible, between patients, family members, and other visitors and clinical staff. And this can be remote communications, for example, using the phone alone for an infected patient and their families, or internet connection, telemedicine, a lot of other things which will prevent direct contact of the client's family with the client until they have recovered. Restrict entry to visitors who are essential. So there are some patients, especially the pediatric patients, who we consider essential clients. And they will need caregivers around, but we should ensure that these caregivers are not all over the place and their entry is restricted and properly controlled. Encourage family members to assign a single caregiver to a patient so that it will limit the number of people that are exposed to this patient, especially during the COVID-19 treatment period. We should not also encourage this single caregiver to be somebody who is high risk, such as an elderly person or people with underlying medical conditions. And then we should designate an entrance that visitors who are caregivers can use especially if it is possible. If not, then we find ways to ensure that everyone is protected. Administrative measures number 2, maintain a record of all visitors that come to the facility, educate caregiver visitors on hand hygiene, respiratory etiquette, physical distancing, and other standard precautions on how to recognize signs and symptoms. So we should basically educate everybody on COVID-19, on infection prevention. Depending on the type of infection the patient has, the caregivers and family members should be properly educated. We should train and supervise caregiver visitors of patients with suspected or confirmed infections. Caregiver visitors in areas with community transmission, including those caring for patients without suspected COVID-19, should wear a medical mask at all times. Restrict movement of visitors within the healthcare facility. And then we should also reduce traffic to areas within the facility. So for example, if an area within the facility sees a lot of outpatients, ideally, for example, the pharmacy, if possible, can have a window that now, instead of patients queuing within, can rather queue outside where there's more fresh air, and to limit traffic within the facility itself. So what type of environmental and engineering controls are needed? These environmental and engineering controls are an integral part of IPC, because if a place is cramped in and there is no fresh air, the design is poor and all those things, there's no ventilation, it can quickly harbor pathogens which can be transmitted onto other people. So structural design is important, spatial separation is very important, adequate environmental cleaning is important, and this is where we engage our biomedical engineers, our facility engineers, structural engineers, to make sure that we meet all the necessary requirements for our IPC and also prevent infection transmission within our facilities. What about outpatient care? The basic principles for IPC and standard precautions should be applied in all healthcare facilities, especially in the outpatient settings. Outpatient settings, especially the OPD area, waiting areas, can be an easy source of transmission of infections if not properly controlled, if not properly ventilated, and if the clients are not properly protected. So the following measures are recommended: screening, early recognition, and isolation of patients who are suspected to have infections. Very, very important. We shouldn't allow somebody who we suspect has had an infection to sit among other people for very long periods because the risk of transmission becomes high. Consider alternatives to face-to-face outpatient patient visits. So for example, some facilities now, especially when they notice that you are infectious, they'd rather do a telephone consultation or a cell phone video conference or other types of telemedicine to ensure that we limit your face-to-face interaction. We also now provide clinical support without direct contact with the patients in most cases. We emphasize on hand hygiene, respiratory hygiene, medical masks to be used by all patients, especially those with respiratory symptoms. And then within the facility for the medical personnel, appropriate use of contact and droplet precautions when performing clinical exams on our patients. So our masks, our gloves, our shields, and everything else. We should also prioritize care for symptomatic patients, especially in the OPD setting. If somebody is symptomatic, it's an emergency, they should be seen very quickly. And then we should educate patients and families about the early recognition of symptoms and report them for early management. What about for the lab personnel and then specimen collection? This is another area where transmission of infection can happen if not properly done. There are a few suggestions here. We should ensure that all health workers who collect specimens, including nasopharyngeal or oropharyngeal or any type of specimen from an infected patient, use the appropriate personal protective equipment, which includes eye protection, medical masks, N95, FFP2, KN95, and then long sleeve gown and gloves. Ensure that all persons who transport specimens are trained and they know how to handle these specimens, the handling practices, and spill decontamination, etc. And then we should place specimens for transport in a leak-proof specimen bag, sometimes secondary containers that have separate sealable pockets for the specimen. This is very important. Sometimes we also call that the biohazard specimen bag. So these things are key, especially for any specimen that we know that it's contaminated or is potentially contaminated. And we should also label it properly. The patient's name, date of birth, clinical diagnosis, especially if it's a suspected COVID-19 patient. Ensure that laboratories in healthcare facilities adhere to the proper biosafety practices and transport requirements based on WHO's interim guidance on laboratory biosafety guidance. And these are very, very key things. Sometimes we tend to relax the rules when it comes to transporting specimens or even taking specimens, but it's important that we go with what is best practice. Ghana has a very good document on this, and then we follow the necessary guidance to ensure that everybody is safe. And then finally, deliver all specimens by hand whenever possible. If you're in a hospital where you have a pneumatic tube or what we call the tubing system where you can shoot a specimen from one floor to the other, they do recommend that for infectious specimen, you hand them over possibly by yourself. Also, if you're not sure of the person you are giving the specimen to, it is best to do the transportation of the specimen by yourself, not give it to somebody to just deliver. What about surgeries? Any decision on whether to operate on a patient should not be done based on the patient's COVID-19 status or infection status, but on the need for the surgery. That is number one. And then also on the risk and benefits of the surgery. For example, if it is a life-threatening surgery, or if the patient will have a life-threatening outcome if surgery is not done, then this has to be done. And then also the patient's clinical conditions at the time that the surgery is needed. In the context of COVID-19 pandemic, every surgical procedure may entail a risk for both the healthcare worker or the patient. So proper assessment needs to be done, and I believe facilities do have surgical guidelines for infected patients, and these should be strictly followed. Currently, what they recommend is, because of COVID-19 and other infections, at least for any patient that is going to undergo surgery, where it is not an emergency surgery that they need to go in right away, they should have a COVID test done, especially if they are showing symptoms, and the people performing the surgeries, from the surgeon all the way to the least person, should be being a proper PPE and even augmented protection if you suspect that the patient is infected. I suggest we refer to our institutional guidelines or the national guidelines for further, because it's further broken down into the different types of surgeries and the different types of patients that will come into your institution for surgical procedures. In conclusion, it's very important for healthcare workers to be conversant with IPC strategies and policies within your facility and then nationally. And then implementation and adherence to IPC policies will prevent infection, will limit infections, and also let's think best practice. When we think about how best this can be done, we put ourselves there as one of the best in terms of healthcare, health practice, and also how we take care of our patients. Finally, let's protect each other and our patients. Let's ensure the necessary tools and protocols and guidelines are always available and well known, well implemented, and as a country, Ghana is there to win. Thank you.